Namaste and welcome to the world of yoga. Today I will be taking you all through the common yoga protocol proposed for the International Day of Yoga, which is observed on 21st June every year. Disclaimer: the information provided in this common yoga protocol is intended to create general awareness among people and community to get harmony and peace through yoga. The information, techniques, and suggestions mentioned in this yoga protocol are not a substitute for the medical advice of a physician. In a particular case that you may require diagnosis or medical attention, consult your healthcare provider before practicing yoga. The presenter does not assume any responsibility or liability for any injury or loss that may result from practicing yoga. We shall start with an invocation to the higher reality by reciting a prayer. Sangachatvam Savadadvam Sangachatvam Savadadvam Sangho Manasi Janata Deva Bhagam Yatha Purve Deva Bhagam Yatha Purve Sanjanana Upasate Sanjanana Upasate Sanjanana Upasate. योग इतिहास, योग प्रणाली तथा योग की जीवंत संप्रदाय के सभी अग्रिम गुरुजनों, प्रचारकों और संरक्षकों के प्रति मैं आत्मीय नमन एवं विशाल कृतज्ञता व्यक्त करती हूँ. ओम. To all the great teachers, preachers and patrons of yoga history, heritage, yoga system and existing sect of yoga, I express my sincere respect and great gratitude. Om. Let us begin with the Chalan Kriyas, the loosening practices, also known as Yogic Shukshma Vyayams. They help to increase microcirculation. These practices can be done while standing and sitting. First, neck bending or Griva Shakti Vikasak. Stage 1. Forward and backward bending. People suffering from cervical spondylitis should avoid doing this. Keep the hands straight beside the body. This is Samasthiti. Either continue in this position or you can keep your palms on the waist. Now, while inhaling, move the head up and bend back comfortably. While exhaling, move the head forward slowly and try to touch the chin to the chest. Come back to the center. This is one round. Repeat 2 more rounds. Stage 2. Right and left twisting. Keep the head upright. While exhaling, gently turn the head to the left so that the chin is in line with the shoulder. While inhaling, bring the head to the normal position. Similarly, while exhaling, turn the head to the right. Inhale and bring the head to the normal position. This is one round. Repeat 2 more rounds. Stage 3. Right and left bending. While exhaling, bend the head slowly to the left. Bring the ear as close as possible to the shoulders without raising the shoulder. While inhaling, bring the head to the normal position. Similarly, while exhaling, bend the head to the right side. Inhale and bring the head up to the normal position. This is one round. Repeat 2 more rounds. Second, shoulders movement or Skandha Vikasak. Avoid doing this in case of frozen shoulders. Stage 1, shoulder stretch, Skandha Khichav. Keep the feet together, the body straight and the arms by the sides. While inhaling, raise your both arms slowly from sideways above your head. Raise your heels simultaneously. Exhale and bring hands and heels down in the same manner. Stage 2, shoulders rotation, Skandha Chakra. Stand erect. Place the fingers of the left hand on the left shoulder and the fingers of the right hand on the right shoulder. Full rotation of both elbows in a circular manner. Inhale and raise your elbows and bring them back when you exhale. Try to touch the elbows in front of the chest on the forward movement. Stretch the elbows back in the backward movement and touch the side of the trunk while coming down. Repeat this 2 times, rotating from front to back. Do the same in reverse manner. Inhale while raising the elbows and exhale while bringing them down. Practice of this yogic kriyas makes the bones, muscles and nerves of the neck and shoulder healthy. These practices are helpful in cervical spondylosis and frozen shoulders. Third, trunk movement or Kati Shakti Vikasak. Cardiac patients shall do with care. Avoid this practice in case of severe back pain, vertebral and invertebral disc disorders and during menstruation. Keep the legs about 2-3 feet apart. Raise both the arms up to shoulder level with palms facing each other and keep them parallel. While exhaling, twist the body towards the left side so the right palm touches the left shoulder. Come back with inhalation. While exhaling, twist the body towards the right side so that the left palm touches the right shoulder. Come back with inhalation. Do it slowly with coordination of breathing. This is 1 round. Repeat it 2 more times and then relax in Samasthiti. Fourth, knee movement, Ghutna Sanchalan. Avoid this asana in case of acute conditions of arthritis. Keep the legs about 2-3 feet apart. Inhale, lift your arms up to the shoulder level, palms facing downwards or in a fist. Exhale, bend the knees and bring down the body to the semi-squatting position. In the final position, both the arms and thighs should be parallel to the ground. Inhale and straighten the body up. Repeat it 2 more times. It helps to strengthen knees and hip joints. After the Sukshma Vyayams, now we will do the Yoga Asanas. First, the standing postures. Tadasana, the palm tree posture. Tad means palm tree or mountain. This asana teaches one to attain stability and firmness and forms the base for all the standing asanas. Avoid lifting the heels in case of arthritis, varicose veins and vertigo. Stand with feet 2 inches apart. Inhale, lift your arms up, interlock the fingers and turn the wrist outside. Now inhale, raise the arms up above your head. Raise the heels of the floor and balance on the toes as you raise your arms. Stay in this position for 10 to 30 seconds. Exhaling, bring the heels down, release the interlock of the fingers, bring the arms down and come back to the standing posture. This asana brings stability in the body, helps to clear up congestion of the spinal nerves and corrects faulty posture. Vriksh Asana, the tree posture. The final position of this asana resembles the shape of a tree, hence the name. Avoid this practice in case of arthritis and vertigo. Stand with feet 2 inches apart. Focus on a point in front. Exhale, hold and bend the left leg, then place the foot on the inner side of the right thigh. The heel should be touching the perineum region. Inhale and extend the arms up and join the palms together for Namaskar Mudra, either at the sternum in front of your chest or above your head. Stay in the position for 10 to 30 seconds and breathe normally. Exhaling, bring the arms down. Release the left leg and bring it to the initial position. Repeat this asana from the right side as well. This asana helps to improve neuromuscular coordination, balance, endurance, alertness, and concentration. Padahastasana, the hands to feet posture. Pada means feet, hasta means hands. Hence, Padahastasana means keeping the palms down towards the feet. Avoid this practice in case of cardiac disorders, vertebral and disc disorders, abdominal inflammation, hernia and ulcers, glaucoma, myopia, and vertigo. Those who are suffering with stiff backs should bend according to their capacity. Stand straight. Inhale slowly and raise the arms up. Stretch up the body from the waist. Exhale and bend forward until both palms rest on the ground or touch the feet. Stretch the back to make it straight as much as possible and try to touch the knees with your nose or the forehead. Maintain this final posture for 10 to 30 seconds with normal breathing. Now inhale, come up slowly to the upright position and stretch the arms straight above the head. Exhale, slowly return to the starting position in the reverse order. Relax in Samasthiti. This asana makes the spine flexible, improves digestion, and helps in overcoming menstrual problems. Ardhachakrasana, the half wheel posture. Ardha means half, chakra means wheel. In this posture, as the body takes the shape of a half wheel, hence it is called Ardhachakrasana. Avoid this posture in case of vertigo or a tendency to giddiness. Hypertensive patients should bend with care. Stand straight with feet 2 inches apart. Support the back at the sides of the waist with the fingers. Drop the head backwards, stretching the neck muscles. As you inhale, bend backwards from the lumbar region. Exhale and relax. Stay here for about 10 to 30 seconds with normal breathing. Inhale and slowly come up. Ardhachakrasana makes the spine flexible and strengthens the spinal nerves and muscles. Helps in management of cervical spondylosis. Trikon Asana, the triangle posture. Tri means 3 and kona means an angle. Trikona means triangle. As the asana resembles the triangle made by the trunk, arms and legs, hence the name. Avoid this posture in case of slip disc, sciatica and after undergoing abdominal surgery. Stand with your feet 3 feet apart. Inhale slowly, raise both the arms sideways up to shoulder level. Exhale, slowly bend to the right side and place the right hand fingers close to the right foot. The left arm is straight in line with the right arm. Turn your head and gaze at the tip of the left hand. Remain in this posture for 10 to 30 seconds with normal breathing. Inhale, slowly come up. Repeat the same procedure from the other side. Do not try beyond limits and overdo the lateral stretch. If one cannot touch the feet, one can reach for the knees instead. This asana makes the spine flexible, strengthens calf, thigh and waist muscles and improves lung capacity. Second, sitting postures. Dandasana, staff pose. Sit comfortably on your sitting bone and extend your legs straight in front of you. Take hold of the flesh of each hip and move it out of the way to give a more grounded feeling. Engage your thigh muscles and flex both feet. Stack the shoulders directly on top of the hips. Release your shoulders away from your ears. Keep the arms straight and the palms flat on the floor on either side of your hips to support your spine. Inhale to lengthen your spine. Bhadr Asana, the firm or the auspicious posture. Avoid this practice in case of severe arthritis and sciatica. Sit straight with legs stretched out in the front in Dandasana. Now, pull the soles of your feet together. Exhale and clasp your hands together over your toes. Inhale, pull your heels as close as possible to the perineum region and try to touch your thighs to the floor. This is the final position. Stay in this position for some time with normal breathing. This posture helps to keep the body firm and stabilizes the mind, helps during pregnancy and relieves the abdominal pain often experienced during menstruation. Vajrasana, the thunderbolt posture. This is considered as one of the meditative poses. While practicing it for meditative purposes, one should close his or her eyes at the final stage. People suffering from piles should not practice this asana. Those who are suffering from knee pain and ankle injury should avoid this practice. Sit in Dandasana. Now fold the left leg at the knee and place the foot under the left buttock. Similarly, by folding the right leg, place the right foot under the right buttock. Place both the heels in such a way that the big toes touch each other. Position the buttocks in the space between the heels. Keep both the hands on respective knees. Keep the spine erect, gaze in front or close the eyes. This is the final position. This asana is good for digestion, strengthens thigh muscles and calf muscles. Ardhaustrasana or the half camel posture. Ushtra means camel. The final version of this asana resembles the hump of a camel. In case of hernia and abdominal injuries, arthritis and vertigo, please avoid doing this asana. Sit in Vajrasana. Stand on your knees and place your hands on the hips. Bend the head back and stretch the neck muscles. Inhale and bend the trunk backwards as much as possible. Now exhale and relax. Keep the thighs perpendicular to the ground. Remain in this posture for about 10 to 30 seconds with normal breathing. Return with inhalation and sit in Vajrasana. This asana helps to strengthen your back and neck muscles, relieves constipation and back pain, increases blood circulation to the head and cardiac region. Ushtrasana, the camel posture. Ushtra means camel. The body in this posture resembles a camel, hence the name. Those suffering from heart diseases or hernia should not practice it. Sit in Vajrasana. Bring the knees and the feet about a few inches apart and stand on your knees. While inhaling, bend backward, place the right palm on the right heel and the left palm on the left heel and exhale. Be careful not to jerk the neck while bending backward. In the final position, thighs will be vertical to the floor and head tilted backwards. Weight of the body should be evenly distributed on the arms and legs. Remain in this posture for about 10 to 30 seconds with normal breathing. Return with inhalation. Sit in Vajrasana. Ushtrasana is extremely useful for defective eyesight. This is useful in relieving back and neck pain. It helps to reduce fat over the abdomen and hips. It is very helpful in digestive problems and cardiorespiratory disorders. Shashakasana, the hair posture. Sasak means hair. The body in these poses resembles the hair, hence the name. Kindly avoid this posture in case of acute backache. Patients with osteoarthritis of the knees should avoid Vajrasana. Sit in Vajrasana. Inhale. Exhale and bend forward with arms outstretched and place the chin on the ground. Keep the arms parallel and maintain the posture for some time. Come back to Vajrasana. This helps to reduce stress and anxiety, tones up the reproductive organs, relieves constipation, improves digestion, and helps to relieve back pain. Uttanmandukasana, stretched up frog posture. Uttan means upright and Manduk means frog. The final position of Uttanmandukasana resembles an upright frog, hence the name. People with severe knee joint pain and frozen shoulders should not perform it. Sit in Vajrasana. Spread both the knees wide apart while big toes touching each other. Raise both arms, fold from elbows and take them backward above the opposite shoulders and place the palms on the shoulder blades. Maintain the position for a while and come back slowly in the reverse order. This asana is helpful in back and neck pain, especially cervical spondylosis. Improves the diaphragmatic movements and lung capacity. Vakrasana, the spinal twist posture. Vakra means twisted. In this asana, the spine is twisted, which has a rejuvenating effect on its functioning. Kindly avoid this posture in case of acute back pain, spinal disorders, after abdominal surgery and during menstruation. Sit in Dandasana. Bend the left leg at the knee and place the left foot beside the right knee and place the left palm behind the left hip and keep the back straight. Bring the right arm around the left knee and place the palm beside the left foot. Exhale, twist your body to the left and look behind as much as you can. Remain in this posture for 10 to 30 seconds with normal breathing and relax. Inhale, take out your hands and exhale to relax. Repeat the same on the other side. This pose helps to increase flexibility of the spine, stimulates pancreas functions, and helps in the management of diabetes. Third, the prone postures. Makarasana, the crocodile posture. In Sanskrit, Makar means crocodile. In this asana, the body resembles the crocodile, hence the name. Avoid this practice in case of pregnancy and frozen shoulders. Lie down on your stomach with feet wide apart. Bend both the arms and place the right palm on the left one. Place the head either left, right or down facing on your hands. Keep the eyes closed and relax the whole body. This asana is practiced for relaxation in all prone postures. It promotes relaxation of the whole body, helps in recovery of back problems, indicates to counter stress and anxiety. Bhujangasana, the cobra posture. Bhujang means snake or cobra. In this asana, the body is raised like the hood of the snake, hence the name. Those who have undergone abdominal surgery should avoid this asana for about 2-3 months. Those who suffer from hernia, ulcers should not practice this asana. Lie down on your stomach. Keep the forehead on the ground. Now place your palms on the ground beside your chest and elbows rested down well. As you inhale slowly, lift the head and chest up to the navel region without changing the position of the palms. Stay there comfortably. Now come back and place your forehead on the ground. Come back to Makarasana and relax. While doing the asana, keep the legs firm so that no load or strain is felt on the lumbar spine. This asana relieves stress, reduces abdominal fat, and relieves constipation. helps to relieve backache and bronchial problems. Shalabhasana, the locust posture. Shalabh means locust. Please proceed cautiously in case of severe lower back pain. People with high blood pressure, peptic ulcer and hernia should also avoid this posture. Lie down on your stomach. Rest the chin on the floor. Keep both hands beside the body or under the respective thighs, palms facing upwards. Inhale, raise the legs off the floor as much as you can without bending the knees. Stay in this position for about 10 to 30 seconds, breathing normally. Exhale, bring the legs down towards the floor and relax. Relieves in sciatica and lower backache. It also helps to reduce fat in the thighs and buttocks. It's good in weight management and helps to improve lung capacity. Fourth, the supine postures. Setubandhasana, the bridge posture. Setubandha means formation of the bridge. In this posture, the body is positioned like a bridge and hence the name. People suffering from ulcer and hernia should not practice this asana. Lie down supine, that is on your back. Bend both the legs at the knees and bring the heels near the buttocks. While holding both the ankles firmly, keep the knees and feet in one straight line. Inhale, slowly raise your buttocks and trunk up as much as you can to form a bridge. Remain in this position for 10 to 30 seconds with normal breathing. Exhale, slowly return to the original position and relax. This asana relieves depression, anxiety, and strengthens lower back muscles. It stretches abdominal organs, improves digestion, and helps to relieve constipation. Uttanmandukasana, raised feet posture. Uttan means raised upward and Pada means leg. In this asana, the legs are raised upward in supine position, hence the name. People with hypertension and back pain should practice it with one leg alternatively without holding the breath and with ease. Lie comfortably on the ground with legs stretched out. Hands should be placed by the sides. While inhaling, slowly raise both the legs without bending them at the knees and bring them to a 30-degree angle with the ground. Maintain the position for about 10 to 30 seconds with normal breathing. Exhale, slowly bring both the legs down and place them on the ground. Relax. This pose balances the navel center, the Manipur chakra. It helps in relieving abdominal pain, flatulence, indigestion, and diarrhea. It strengthens the abdominal and pelvic floor muscles. Effective in overcoming depression and anxiety. Ardhhalasana, half plow posture. Ardha means half and hal means plow. This posture is known as Ardhalasana because in its final position, the body resembles half the shape of an Indian plow. Those who have lumbosacral, the lower back pain, should not perform with both legs together. Avoid this practice in case of abdominal injuries, hernia, etc. Lie in supine position, keep hands beside the body and palms resting on the ground. Inhale, slowly raise your legs together without bending at knees and bring them up to 90-degree angle with the ground. The body from hips to shoulders should be kept straight. Maintain this position comfortably for about 10 to 30 seconds with normal breathing. Exhale, slowly bring the legs down to the ground without lifting the head. Relax. This asana relieves constipation, is beneficial for hypertensive patients, but needs to be practiced under supervision. Pawanamuktasana, the wind relieving posture. Pavan means wind and mukta means to release or to make free. As the name suggests, this asana is useful in removing the wind or flatulence from the stomach and intestines. Avoid this practice in case of abdominal injuries, hernia, sciatica, severe back pain, and during pregnancy. Lie down flat on the back. This asana can be performed either with one leg after another or with both legs together. Synchronize your breathing with the leg movement. While touching the knee with the nose or the forehead, you should be able to feel the lumbar region stretch. Keep the eyes closed and focus your attention on the pelvic and the lumbar region. Now, bend both the knees. Exhale, bring both the knees towards the chest. Inhale, interlock the fingers and clasp the shin below knees. Exhale, raise the head till your chin touches the knees and relax. This is Pawanamuktasana. Now, bring the head back to the ground. While exhaling, bring the legs back to the floor and relax. It removes constipation, gives relief from flatulence, decreases the bloating sensation in the abdomen and aids digestion, generates deep internal pressure, improves stretching of the highly complicated network of muscles, ligaments and tendons in the pelvis and waist region. It tones up the back muscles and spinal nerves. Shavasana, the corpse posture. Shava means dead body. The final position in this asana resembles a corpse or a dead body, and hence the name. Lie down on your back with arms and legs comfortably apart, palms facing upward, eyes closed. Relax the whole body consciously. Become aware of a natural breath and allow it to become slow and shallow. Remain in this position till you feel refreshed and relaxed. Shavasana helps to relieve all kinds of tensions and gives rest to both body and mind. Relaxes the whole psychophysiological system. The mind, which is constantly attracted to the outer world, takes a U-turn and moves inwards, thus gradually getting absorbed. As the mind turns quiet and absorbed, the practitioner remains undisturbed by the external environment. It is found very beneficial in the management of stress and its consequences. After the asanas, now we move on to the breathing techniques, pranayamas. Kapalbhati. Avoid this practice in case of cardiac conditions, giddiness, high blood pressure, vertigo, chronic bleeding in the nose, epilepsy, migraine, stroke, hernia, gastric ulcer, pregnancy, and during the menstruation cycle. Sit in any meditative posture, example Sukhasana, Padmasana, Ardhapadmasana or Vajrasana. Inhale deeply through both the nostrils. Expand the chest. Expel the breath with forceful contractions of the pelvic and abdominal muscles and inhale passively. Do not strain. Continue active forceful exhalation and passive inhalation. Complete 30 rapid breaths, then take a deep breath. Exhale slowly and relax completely. This is one round of Kapalbhati. Each round shall be followed by being still for a while. Repeat 2 more rounds. Kapalbhati purifies the frontal air sinuses, helps to overcome cough disorders. It is useful in treating cold, rhinitis, sinusitis, asthma, and bronchial infections. It rejuvenates the whole body and keeps the face glowing and vibrant. It strengthens the nervous system and tones up the digestive organs. Anulom Vilom Pranayama, the alternate nostril breathing. Sit in any comfortable meditative posture. Keep the spine and head straight. Relax the body with a few deep breaths. Keep the left palm on the left knee in Jnana Mudra and the right palm should be in Vishnu Mudra. You may choose to keep your eyes closed or open. Place the ring and small fingers on the left nostril and fold the middle and the index finger to touch the base of the palm. Place the right thumb on the right nostril. Open the left nostril, breathe in from the left nostril, close the left nostril with the small and ring fingers and release the thumb from the right nostril. Exhale through the right nostril. Next, inhale through the right nostril. At the end of inhalation, close the right nostril, open the left nostril and exhale through it. Breath should be slow, steady and controlled. It should not be forced or restricted in any way. This completes one round of Anulom Vilom. Repeat 4 other rounds. This pranayama induces tranquility and helps to improve concentration, increases vitality and lowers the low level of stress and anxiety. It alleviates cough disorders. Sheetali Pranayama. Sheetali means cooling. Those who are suffering from a severe cold, cough or tonsillitis should not do this pranayama. Sit in Padmasana or any other comfortable meditative posture. Place the hand on the knees in any mudra. Roll the tongue from the sides to shape it as a tube. Inhale through this tube-shaped tongue. Fill the lungs with air to their maximum capacity. Take the tongue inside the mouth and close the mouth. Then slowly exhale through both the nostrils. This is one round of Sheetali Pranayama. Repeat it 4 more times. It has a cooling effect on the body and mind. It is beneficial for persons suffering from high blood pressure. It satisfies thirst and appeases hunger. It relieves indigestion and disorders caused by phlegm and bile. It destroys the disorders of chronic dyspepsia and spleen or other related diseases. It is beneficial for skin and eyes. Bhramari Pranayama, the bee's breath. Bhramari is derived from Bhramar, which means black bee. During the practice of this pranayama, the sound produced resembles the buzzing of a black bee, hence the name. Avoid this practice in case of nose and ear infections. Sit in any comfortable meditative posture. Inhale deeply through the nose. Close the eyes with the index fingers. Place the middle finger on side of nose. Don't close it. Mouth with the ring and small fingers, ears from respective thumbs. This is also called Sanmukhi Mudra. Now exhale slowly in a controlled manner while making a deep, steady humming sound such as that of a black bee. This is one round of Bhramari. Repeat it 4 more times. The practice of Bhramari relieves stress and helps in alleviating anxiety, anger, and hyperactivity. The resonance effect of humming sound creates a soothing effect on the nervous system and mind. It is a great tranquilizer found good in the management of stress-related disorders. It is a useful preparatory pranayama for concentration and meditation. Dhyana, meditation. Meditation is an act of continuous contemplation. Sit in any meditative, comfortable posture. Keep your spine comfortably erect. Adopt Gnana or Dhyan Mudra. Keep your palms facing upwards upon the thighs. Arms and shoulders should be loose and relaxed. Close your eyes and sit with the slightly upturned face. You need not concentrate. Just maintain a mild focus between the eyebrows and be conscious of your breath. Dissolve your thoughts and try to attain single and pure thought. Meditate. Stay as long as you can. Meditation is the most important component of yoga practice. It helps the practitioner to eliminate negative emotions like fear, anger, depression, anxiety, and to develop positive emotions. Keeps the mind calm and quiet. Increases concentration, memory, clarity of thought, and willpower. Rejuvenates the whole body and mind, giving them proper rest. Meditation leads to self-realization. This brings us to the end of the common yoga protocol practice session. Let us end this with a prayer and a sankalp. हमें अपने मन को हमेशा संतुलित रखना है, इसी में ही हमारा आत्मविकास समाया है, आत्मविकास समाया है. Our self-development is possible only if we maintain a balanced state of mind all the time, all the time, all the time. संकल्प. मैं अपने कर्तव्य खुद के प्रति, कुटुंब के प्रति, काम, समाज और विश्व के प्रति शांति, आनंद और स्वास्थ्य के प्रचार के लिए बद्ध हूँ. I commit to do my duty to myself, my family, at work, to society and to the world for the promotion of peace, health and harmony. Om Shanti Shanti Shanti.